So we did a trial. We did the Vitagog trial, which recruited people with mild cognitive impairment who have a rate of brain shrinkage of about 1% per year. And we randomized them, and we gave half of them placebo, and the other half we gave a mixture of folic acid, B12, half a milligram, and B6. And we followed them for 2 years, and we measured the rate of brain atrophy, and we measured various cognitive measures. And as you can see from the title of this paper, we did manage to show prevention of grey matter atrophy in people with mild cognitive impairment by giving B vitamins. So, in those with high homocysteine at baseline, in other words, in those with low B vitamin status, as indicated by the high homocysteine, they responded to the B vitamin treatment with a marked slowing of the rate of brain atrophy, slowed by 53%. When we looked at specific brain regions, as I'll show you in a minute, we found that the slowing of atrophy of these special brain regions which go in Alzheimer's was even stronger. It was 90% slowing. And finally, this treatment slowed, or even in some cases completely stopped, cognitive decline. So memory decline was actually stopped by this treatment. So here's a slide showing in yellow, the areas in the brain of the placebo group which showed significant atrophy, highly significant, as you can see, over the 2-year period. And I've indicated the medial temporal lobe with the red arrow. That's where the hippocampus is. And you can see that that's one of the areas that shows marked atrophy over the 2-year period. So that's in the placebo group. So what happened in those where we treated with B vitamins? That's what happened. I think you'll agree, a pretty dramatic reduction in the volume and in the extent of the atrophy of these brain regions, including particularly the medial temporal lobe, which is much less atrophied. So this shows that lowering homocysteine with B vitamins can actually modify the disease process. So we did some statistics to look at the causal pathway. Oh, sorry, I can't resist showing you this nice picture that my imaging colleague produced. The areas in blue are those areas protected by B vitamins. So it's not the whole brain that's protected, it's very specific areas. And these specific areas are, of course, important in cognition. So we did some statistical analysis as to what the causal pathway is, and you could say that we have a kind of matrix here with Vitagog. We have B vitamin treatment, we measured brain shrinkage, we measured plasma homocysteine, we looked at cognitive decline. And what we did a Bayesian acyclic graph analysis, which is a way of looking at mediating pathways. And we found that, in fact, B vitamin treatment, in particular the B12, turned out to be important, lowers plasma homocysteine, which in turn slows brain shrinkage, which in turn slowed cognitive decline. So this is a causal pathway. These arrows indicate causal links. So if we summarize then the outcomes of this trial, the B vitamin treatment slowed whole brain atrophy in mild cognitive impairment. It slowed atrophy, especially in those brain regions affected in Alzheimer's, by as much as 9-fold. Slowed cognitive decline in several domains and improved clinical status. I haven't shown you that, but it actually improved the clinical status. They got better. So overall, we think the B vitamins had a disease-modifying effect. Now, I can't resist saying this, that the drug companies have been spending, the estimate is about $200 billion so far, on trying to find a disease-modifying treatment for Alzheimer's disease. They've completely failed. Every treatment, every trial they've ever done has failed on the beta amyloid hypothesis. Here's a simple nutritional intervention that slows the disease process. Certain corollaries, though. These responses in people with cognitive impairment only occurred in subjects with baseline homocysteine above the median. In other words, they had impaired B vitamin status, but they were not deficient. And as I will now show, and finally end, those with good omega-3 fatty acid status. And I'll start by reminding you that what I said earlier, that omega-3 fatty acids can affect the rate of brain atrophy. Here's a very nice study where they measured the red blood cell levels of omega-3 fatty acids, and they found that the higher the level of omega-3 in the red cells was associated with, the lower the levels of omega-3 in the blood cells associated with smaller brain volume, greater white matter damage, and poorer cognition.